Dr. Childress here. I'm doing my Vitae Series. Welcome. We're up to the point of my finishing my postdoctoral training and my shift over to working with Children's Hospital of Orange County and the UCI Child Development Center on the identification of ADHD in preschool age kids. Now, the Children's Hospital of Los Angeles and Orange County have a psychology department. And so there was a psych department within the hospital. And one of the functions of a pediatric psychologist is to do consults on the various units. So while I was at CHLA, I was primarily doing consults with the spina bifida clinic. There was an intern who would be called for consults on oncology, or another intern who'd be called for nephrology. And so each intern had their clinic rotation. When I moved to CHOC, Orange County, now I'm on medical staff, which is a little bit rare for psychologists. And so Dr. Watkins, who was head of the psych department, was very proud of that he got his psychologists accepted on medical staff at the hospital. And so I was on medical staff there. And my role was within the hospital was to go on consults. I would have my day on call where I would, cancer clinic, they're diagnosed a kid with cancer, and they're telling their families they're going to present the diagnosis. You know what? Let's get a psych consult on this, on breaking the news to the family. Psych consult. Give a call down to the psych department. Who's ever on call goes up. So you're going to be at any clinic dealing with anything. One of the most difficult cases that I was called up on a psych consult with a mother with twins, about 3 years old, and she was taking a nap. One of the twins got out the door and fell in the pool and drowned. They took her to Children's Hospital of Orange County, resuscitated the kid, and the kid survived. But the lack of oxygen created brain damage. So the kid was kind of like cognitively impaired from that point on. And so now here, this mother has these two twins. One of them's going to age and develop normally, and the other one's always going to be impaired because she fell asleep and took a nap. Wow. And the medical staff goes, wow, that's just tough on the mom to kind of process this kind of stuff. Let's get a psych consult on this. Huh? And I somehow have to come into this and help this mom. That was an impactful case. Drowning of a twin, and the long-term issue consequences of that. So you get called up on the psych consults on that side. On the UCI collaboration, my primary role was to head up the parent training component. We were using a particular type of parenting model. It's called COPE. It's out of Canada. And it shows videos of problematic parenting, and then we lead group discussions about how that parent can correct things. And the curriculum blends into the videotapes we're presenting, and so there's a structured curriculum. And so I was training all of the parent training people in how to do the COPE model, how to do Socratic questioning to teach a specific set of parenting skills, standard behavior parenting skills, reinforcing positive behavior, response costs, timeouts for negative behavior, just token economies, the standard behavioral curriculum. It's just the method by which it was presented was a little unique. And then I was working down there with their child development psychologist in their school, and they were collaborating with the project, the ADHD, and so we had cross-pollination down there in terms of our work together. In addition, Children's Hospital of Orange County has an APA accredited internship, and so the interns that would come into the CHOC program, I was clinical supervisor for some of them in some of their rotations. And so I provided supervision for the interns as part of the APA internship program. And then they had two postdocs who also were came to Children's Hospital of Orange County, and I was supervisor for them on their UCI ADHD rotation. And so testing that they did, the parenting training courses that they ran, those sorts of things. I was a clinical supervisor on that. And so I worked with that for a couple of years. And it's ADHD in preschoolers. And my specialty was ADHD. I read nearly everything in ADHD. There was one point I had read every parenting training article out there, like 1992, and I could not find a parenting article, book thing that I had not read. So I know parenting skills. I know ADHD. I've looked at and for ADHD and solving them, I kept working younger and younger in the age group. I'm a good behavior therapist, and maybe if we caught it early enough, we could remediate it. While at Children's Hospital of Los Angeles, CHLA, in my postdoc year, I went over to the oncology clinic as well and worked over there as a research assistant on a multi-site research project on the cognitive remediation of attention deficits associated with intrathecal chemotherapy that creates attention problems. And they were looking at a way of remediating that through various exercises and cognitive exercises. It was multi-site research, CHLA, MD Anderson, CHOP out of Philadelphia. So about 5, I think, universities. When they flew us down to Houston, we trained up in the assessment protocol. They came back and started to do the remediation of attention deficits in these kids. That was in my postdoc year. At the UCI project, we were doing a similar sort of thing. So what Jim Swanson's idea is we're going to get all these parents together for this parent training group, and we're going to invite them to bring their kids who we're going to have child care groups on. Interesting idea. So we have child care groups running, and it's the child care groups that Jim Swanson wanted access to. And what he wanted to do, and what he did do, was he brought in this emerging model for remediating cognitive or attention deficits by doing computerized training tasks with the cognitive networks. And so the kids, it was in a game format. So the kids would come in and play this computer game that was fixing their attention problems. And so 3 to 5 year olds, these preschool age range, is the population he wants to do it on, and identify. And so there was an undercurrent of clinical research that was part of the overall project, mediating attention deficits in preschool age kids. Now, my background was early childhood too, and as a good behavior therapist, I know ADHD, that's an older kid disorder, but I'm doing early childhood, and I'm learning about the neurodevelopment of the brain, the infant brain, the 1-year-old brain, the 2-year brain. It's coming up this direction. And it's just normal, healthy development as well as trauma development of the brain and how the brain systems work and how they wire themselves up. And now I'm working on a project with preschoolers and ADHD. And my mode of psychotherapy, my domain is shifting. It's shifting from ADHD to early childhood. Seeing if we can catch it early enough, can we fix things? And when you do that, you have to come up the infancy up. You have to understand how the infant brain develops. And as I did that, I realized it became evident that the problems with ADHD are in the relationship systems. That's where they are. Oh my goodness, look at this, look at that. Oh my goodness, look at that. Oh my goodness. And so there's actually non-medication solutions to ADHD. I think 60%, maybe even 70% of ADHD, I can cure the symptoms by helping the parents understand how to respond to the kid, and will remediate those neural networks that are problematic in the child's development. And so, I switched over during that period from ADHD behavior therapist to ADHD kind of ish early childhood professional. ADHD is a symptom. Attention deficits are a symptom. Hyperactivity is a symptom. Putting the word disorder at the end of a set of symptoms is not a diagnosis. That's just attention deficit hyperactivity disorder. What's causing it? There was a point, I'm sitting at CHOC. I have my little office area. And I'm sitting at my desk. And what I did was I created cards with all of the various symptoms of ADHD, learning disabilities, impulse control problems, there's executive function problems. There's a problem in the executive function system of anticipation. It's a time-based system. So I have that up on my thing. And all the various symptoms of ADHD, hyperactivity, attention, everything I'm sitting around. And I looked for every possible associated symptom. I hung these all around my desk area. So I'd be doing my work and then on a consult and things. And I'd come back, I'd take a few seconds, I'd just sit surrounded by it, try to figure out what's the organizing principle, what's the organizing thing that creates a learning disability and executive function problems, and planning and organization problems, and the impulsivity. Okay, why doesn't the impulsivity respond to CBT therapy? There's therapies we should be able to help the child get a handle on their impulsivity. As long as we put the structure in, they can do it. The moment we take the structure away, boop, they pop right back. Why isn't that getting into them? And so I just sit around and ponder that. And as I developed that background in early childhood mental health and the neurodevelopment of the brain, oh, that's why. Oh, I get it. That's the sensory motor. Okay, sensory motor integration. All right, I got it. Okay. Early childhood neurodevelopment of the brain makes total sense on this. So follow me over to my next phase is when I moved out of CHOC.